I think so more than 1,500 people have been registered for this webinar. And now, as you are saying that 1,000 is the capacity. So we will start, sir, and after that, we will stream the link of YouTube to the others.
Ma'am, already it is live, ma'am. So whoever is joining, instead of joining in Zoom, they can directly join in the YouTube, ma'am. Everything is ready.
Okay, directly they will.
From our side, we are ready, ma'am. Just you can just check your team and we can start now.
Yeah. Already, I think more than 1,000 already cost. We can start, ma'am, now.
Sir, Kadiwala sir is here. Hitesh sir, Kadiwala sir.
We are waiting for the ma'am.
Ragna madam.
Yes, yes.
So shall we start, ma'am?
Yes, ma'am. Yes, please. And we share that YouTube link to your WhatsApp also, ma'am, and we keep it in the chat box also. So you can share it with the number of people anybody. If they are unable to join in Zoom, they can join in the YouTube, ma'am. We can go ahead.
Okay. Thank you so much.
Thank you.
Namaste. Very warm and hearty good morning to everyone present here. Dr. Pragna Dabi, Registrar Gujarat Nursing Council, Mr. Deep Kamal Vyas, National Vice President, West Region, Dr. Radha Krishnan G, Additional Professor, NIMHANS and President ISPN, Mr. Hitesh Bhatt, President TNAI Gujarat Branch, Mr. I.A. Kadiwala, Secretary TNAI Gujarat and Vice President Gujarat Nursing Council, Ms. Sampada, Nursing Tutor, the National Apex Coordinating Center, Teleminus and all Delhi. Dr. G. Bala Murugan, Assistant Professor, the National Apex Coordinating Center, Telemanus. Mr. V. Tamil Pulavendram, Nursing Tutor, the National Apex Coordinating Center, Telemanus, and all delegates. On behalf of TNI Gujarat Branch, I, Dr. Indravati Rao, Chairman, Education and Research Committee, TNI Gujarat Branch, and Principal, Government College of Nursing, Surat, extend a warm welcome to all distinguished dignitaries and delegates who had joined us for today's Insight webinar on Overview of Telemanus. Tele-mental health assistant and networking across state. India's flagship initiative for strengthening mental health support through digital platform. In a world where mental health challenges are rising and access to expert support remains uneven, Telemanus emerges as a powerful bridge ensuring timely care, breaking geographical barriers, and bringing support closer to those who need it the most. It is launched by the Ministry of Health and Family Welfare on October 10, 2022, on the occasion of World Mental Health Day. The initiative was announced in the Union Budget 2022 and 23 to improve access to comprehensive mental health services across the country. It is providing 24/7 toll-free mental health helpline services, which is dedicated to making mental health services accessible, confidential, and free for every individual, anytime, anywhere. Today's webinar aims to deepen our understanding of how Telemanus functions, its national and state level impact, and how we all as a healthcare professional, educators, and community leaders can strengthen awareness, promote help-seeking behavior, and support individuals in emotional distress. In short, if I say, Telemanas is not just a helpline, but it is a lifeline for many. So to move ahead, it is indeed a great privilege for us to have an energetic and visionary leader, Mr. I.A. Kadiwala Sir, Secretary TNAI Gujarat Branch, Vice President GNC among us. I invite Sir to deliver welcome address. Sir, please unmute to the Kadiwala Sir.
Sir, please unmute, sir.
कड़ीवाला सर, आप अपने आप को अनम्यूट कर सकते हैं सर. Sir, kindly unmute to the staffy. Sir joined through the staffy, sir. Sir is not able to unmute himself.
Okay, sir's name is Iqbal Kadiwala. That is a account. We are unmuting him. Already it is unmute.
Staffy. The name with Staffy he has joined. So please unmute, sir.
Iqbal Parwa.
Please ask them to raise hand, ma'am, so that we'll find out from here because 1,000 members are there. There is an option to raise hand in the Zoom, so we can immediately unmute.
Just give 1 minute, sir. He is trying to join, sir. Just give me. Wait for a second, please. Sorry for the inconvenience. Due to some reason, he is not able to join. He will be joining in between. So we will take sir's address. So now we are proceeding. And in this juncture, it's my honor more than a pleasure to invite generous, kind nature and always supporting and guiding to the nursing personnel, none other than Mr. Deep Kamal Vyas, sir, National Vice President, TNI West Region. I request to sir to address the gathering and share your valuable insight regarding the Telemanas. Please, sir.
Thank you, ma'am. Am I audible?
Yes, sir, you are audible, sir.
Good morning to everyone. Respected Dr. Pragnada Abhi ma'am, Registrar GNC, Iqbal Kadiwala sir, Vice President GNC and Secretary TNI Gujarat Branch, Shri Hitesh Bhatt sir, President TNI Gujarat Branch, all state TNI executives, dignitaries, esteemed expert speakers who will be guiding us today, and all dear participants. Mental well-being is a crucial pillar for maintaining a balanced and successful life in today's highly competitive world. Through this national initiative, let us collectively understand the significance of mental health through today's webinar session on Telemanas, an overview, and strive to implement it practically for the benefit of society. This module developed by Nimhans is a great resource, and I sincerely urge that nurses at all levels, including our nursing students, recognize their responsibility and actively engage in its implementation. As the National Vice President of TNI, I earnestly appeal to all our members to acknowledge the importance of this mission and contribute wholeheartedly to spreading awareness. Our association is consistently taking strong steps to support and promote such impactful campaigns at the national level. Being part of this mental health awareness movement is indeed a matter of pride for all of us. As frontline healthcare professionals, nurses must play a proactive role in promoting and strengthening mental health services in the community. I express my sincere gratitude to TNI Gujarat State Branch for organizing this meaningful program. And I particularly thank Dr. Indravati Rao Madam, Principal, Government College of Nursing and Chairperson, Education Committee of the State TNI Gujarat Branch for her dedicated efforts and excellent leadership in making this event possible. Without taking much of your time, I humbly request the organizers to proceed with the session, keeping in mind the importance of this topic. Thank you so much.
Thank you, sir. So as the sir said, after the COVID, we all the people recognized that the nurses are the frontline warriors and how the nurses worked. And during that time also we have aware, we can say, and we can recognize that ki how many mental health issues arised. And during that time itself, after the COVID 2020-2022, the teleminers, that initiation has been taken by the government of India. And NIMHANS also played a crucial role for enhancement and awareness of teleminers throughout the country and also in each and every regional area. So thank you so much, Deep Kamal sir. So to proceed, a lady with a vibrant vision, exemplary leadership, and unwavering passion for the nursing profession, our source of inspiration, none other than Dr. Pragna Dabi, Registrar, Gujarat Nursing Council. Ma'am, I request you to share your perspective regarding the telemanas. Pragna Dabi, ma'am. Sir, you have unmuted to Pragna madam.
Yes, yes.
Yes, ma'am. Yes, ma'am can speak now.
Yeah, madam is there. Okay.
Thank you very much, Indravati ma'am. Good morning, one and all. Respected Deep Kamal sir, Vice President, National Branch TNAI. Respected Hitesh Bhatt sir, President, Gujarat State Branch TNAI. Respected Kadiwala sir, Secretary, TNAI State Branch, and Vice President, Gujarat Nursing Council. All the experts from NIMHANS. First of all, I would like to congratulate NIMHANS team and State Branch TNAI team for organizing this webinar. I can see that almost thousands viewers are there. So within a short time, I think Gujarat team did good. And Indravati ma'am, you took initiation very instantly. So it is very good for the Gujarat team that you can do this within a short time. And all of us know that what is the importance of nurses in implementation of any national health program. And especially when we talk about the mental health program, this Telemanas app is just like a blessing for mental health. And Deep Kamal sir said that this is initiation from the National Health Ministry, and it is developed in, I think, 2022. But if I say something about the Gujarat, it is started in 2023, and our hospital for mental health is a apex center for this. 16 counselor and 3 psychiatrists are working 24/7 in these centers. And if I say something about the data, approximate 100 to 150 calls are there in this counseling, and they manage this very effectively. Generally, we know that nowadays anxiety, depression, suicidal cases are increasing day by day. And if we see the data in Gujarat, the suicidal tendency is more compared to other states. So we have to work on this, and through the Telemanas, we can help our community. And I think majority group is the nursing students. So being a nursing students, you can, communicate this Telemanas app to the public in the community. So they can get this mental health services at any time free of cost. So through the counseling, they can get the counseling services. Apart from that, if counselor feels that there is a need of reference, psychiatrists are also available, and video conferencing is also available. Apart from that, through the Telemanas, they get, they get follow-up of the client also. So this is very effective app, and we can address mental health problem through this app. I really happy that Nimhan's team is there with us, and Gujarat is taking advantage of this. So thank you, all of you, Nimhan's team, and congratulate TNAI local state branch for organizing this program. Thank you and best wishes. Thanks a lot.
Thank you so much, Dr. Pragna, madam. Madam has given emphasize how the mental health is matters as the physical health is important. Somewhere the people is not much aware regarding the mental illness. Simply, we are saying that if any deviation in the health, that will be leads to illness. So here also, any deviation in our mental health, it leads to mental illness. Though the government of India has taken initiation in 2022, our Gujarat has taken initiation in this field in 2023. And we have the Apex Center in Ahmedabad. There is having 100 to 150 courses, and daily 100 to 150 peoples are seeking care through these Telemanas. Madam also given the emphasis suicide. Some days before, I have attended one seminar. There, the psychiatrist madam, she has informed each 30 seconds, one people committed suicide. And now the India has become the third leading cause of the death through the suicide. So just see it where we are. This is the era of need. We all will be make aware to ourselves. If we will see 2022, it has come. And if we'll see last 5 years also, how many people are aware regarding Telemanas, even though in our healthcare personnel also, many of the people, they are not aware. So if we are not aware, how we will make others to aware and take the advantages of these services. So to proceed in this webinar, next, it's our privilege to have Dr. Radhakrishnan G, Additional Professor, NIMHANS, and President ISPN. Sir, we are kindly invite you to share your valuable thoughts and give the keynote address.
Good morning to everybody. Namaskar. Respected Dr. Pragna, Dr. Deep Kamal, Dr. Iqbal, Professor Naveen Kumar, Mr. Hitesh, and of course my team from NIMHANS, Telemanas, Dr. Balamurugan. The team is led by Dr. Balamurugan. His tremendous effort in reaching all over India is well appreciated. And we have Ms. Sampata to present the content and the moderator, Dr. Indravati. Good morning to you all once again. And it's nice to have 1,000+ audience in this webinar. Of course, many of us by this time have a fair idea about Telemanas, and it's been running for 3 years. Many conferences Dr. Balamurugan has, his name has become synonymous with the Telemanas now throughout India. So he is trying to give this information to all the nursing community. The reason why nursing community should know Telemanas is for 2 reasons. One, they can take Telemanas support and help the community. We all know that at least 10% of the people across India are suffering with one or other kind of mental illness, which is huge considering 140 crore people what we have. Number one. Number two, at least 30 to 40% of the people who seek treatment in primary health care are somewhere having closer to mental health problems. So considering the 2 points, if I may say that the number of people who are seeking treatment in mental health care is becoming huge. Number one. Number two, people do not come for treatment for some reasons in mental health care. One could be visibly the stigma. Number two could be affordability. Suppose trying to reach Gujarat. I have visited your Gujarat center. I was the inspector. Of course, your medical superintendent and director of the center of excellence. It was to become center of excellence. So I was the inspector there through Indian Nursing Council. And it was a wonderful setting. And our own people who are trained at NIMHANS are working as doctors there. So I'm happy that your center is catering to the Gujarat state, and it's nice to have you all in this webinar. So considering the nature of illness and the treatment gap, of course, all of you, the young children who are here, should know why the treatment gap is more in mental health problems. As I said, one, affordability, reaching the center. Two, stigma. Though I am affordable, I am afraid of coming to centers like NIMHANS because I'll be branded with some name. So these are the problems where people do not come. Considering the nature, Telemanas is a gift, as our previous speakers have said. Telemanas is a gifted approach comparing to the National Mental Health Program, what we had floated 3 decades earlier. Of course, we have the general hospital mental health units. We have the medical college hospital psychiatric units, and we do have DMHP. In addition to that, Telemanas fortifies the gap, bridging the gap. Of course, we need to bridge the gap. Whether the client should come to you or you should reach the client. So Telemanas is one of the approach in reaching the clients. So without taking much time and thanking all the team effort from the Gujarat states, and I request Dr. Balamurugan to take lead in reaching the other states. Of course, I think we have reached at least 15 states now, Dr. Balamurugan.
This is the 10th states actually.
10th state. Yeah. Yes. A few more are in line.
Yes.
I hope we will be able to reach all the states through the Telemanas platform. Madam Indravati, thanks to you in leading this webinar. Over to you. I wish very best for the presenters today. Thank you.
Thank you so much, Dr. Radhakrishna Govindan, sir, for giving the thoughtful insight and saying about where the Telemanas at present. As the sir said, that is a gap between Many of the peoples are there. People are not identifying, not recognizing due to stigma and the nature of the disease condition. And as the telemanas, we all are saying it is the gift, it is the boon for the mental health services. Through that, we can provide comprehensive mental health services. So to proceed, we have Mr. I.A. Kadiwala sir is with us. So I request to I.A. Kadiwala sir to address the gathering. I.A. Kadiwala sir.
Sir, you can
Please unmute to Sonal Pandya. Please unmute to Sonal Pandya.
Yes,
Okay.
ma'am, done.
Yeah.
Sir, please.
So sorry for late. द ट्रेड नर्सिस एसोसिएशन ऑफ इंडिया गुजरात प्रांत की ओर से सबका मैं स्वागत करता हूं। आज के टेलीमानस वेबिनार के चीफ गेस्ट डॉक्टर प्रज्ञा ढाबी, गुजरात नर्सिंग काउंसिल की जो रजिस्ट्रार है, उनका मैं वेबिनार में स्वागत करता हूं। द ट्रेड नर्सिस एसोसिएशन ऑफ इंडिया नेशनल ब्रांच के जोनल वाइस प्रेसिडेंट मिस्टर दीपक कमल व्यास जी का मैं स्वागत करता हूं। प्रेसिडेंट TNAI गुजरात स्टेट ब्रांच श्री हितेश भाई भट्ट का स्वागत करता हूं। खास करके कीनोट एड्रेस जिसका है डॉक्टर सी नवीन कुमार, तो प्रोफेसर एंड हेड कम्युनिटी साइकेट्रिक यूनिट निमांस, उनका मैं स्वागत करता हूं। अभी थोड़ी देर पहले जिनको सुना जो गुजरात में भी आए हैं, ऐसे डॉक्टर राधाकृष्णन जी, उनका भी स्वागत करता हूं। वो निमांस प्रेसिडेंट ISPN है। आज के जो संपदा नर्सिंग ट्यूटर जो है, द नेशनल एपेक्स कोऑर्डिनेटिंग सेंटर टेलीमानस निमांस, उनका स्वागत करता हूं। डॉक्टर जी बालमुरुगन, वो भी निमांस से हैं, असिस्टेंट प्रोफेसर ऑफ नर्सिंग, उनका स्वागत करता हूं। वी तमिल पुवेंद्रम, जो नर्सिंग ट्यूटर है निमांस में, उनका भी स्वागत करता हूं। और डॉक्टर इंद्रावती राव और उनकी पूरी टीम जिन्होंने वेबिनार आयोजित किया है, सबका मैं गुजरात TNAI की ओर से स्वागत करता हूं। आज का जो टॉपिक है बहुत जरूरी है। सुसाइडल केस में, डिप्रेशन केस में पिछले 2-3 साल में मेडिकल, नर्सिंग और स्टूडेंट्स में ज्यादातर सुसाइड का केस गुजरात में ज्यादा हुआ है। ये टेलीमानस की वजह से उनकी जो इम्पोर्टेंट 1 या 2 मिनट रहती है, कहीं उनके पास कोई काउंसलिंग करने वाले हैं, घर में कोई रहता है, या ऐसी हेल्पलाइन से बहुत बड़ा बेनिफिट होगा। क्योंकि जो 2-3 मिनट इम्पोर्टेंट रहती है, सुसाइड जो करने जा रहे हैं उसको 2-3 मिनट कोई सहारा मिल जाता है काउंसलिंग का, तो वो सुसाइड में से बच सकते हैं। ऐसे काफी केस भी हुए हैं कि लास्ट वक्त पे किसी को कॉल करते हैं कि मैं मरने जा रहा हूं, तब उसकी अलग स्किल से समझाने से भी ऐसे केस बचे हैं। छोटी छोटी चीजों में बच्चों को बुरा लगता है, डिप्रेशन में आ जाते हैं। कॉम्पिटिटिव जमाना है, वो पास हो गए, मैं रह गया, वो सब चीजों में डिप्रेशन में ज्यादातर ये टेलीमानस जो हेल्पलाइन है बहुत आपने को इम्पोर्टेंट रहेगी। गुजरात में 2 सेंटर है, अहमदाबाद और राजकोट। वहां पे हर रोज करीबन 200 के करीब लोग ये हेल्पलाइन का यूज करते हैं। सेंट्रल गवर्नमेंट की ओर से 2022 अक्टूबर 10 अक्टूबर, मेरा बर्थडे भी है उस दिन, 10 अक्टूबर को, उस दिन जो हेल्पलाइन सेवा शुरू हुई है। आज का वेबिनार को मैं बहुत बहुत बधाई देता हूँ। सभी जो डेलीगेट्स है, 1500 से ज्यादा डेलीगेट्स हुए हैं। मैं डॉक्टर इंद्रावती राव और पूरी TNAI टीम को बधाई देना चाहता हूं, क्योंकि शॉर्ट टर्म में आपने इतना अच्छा किया। मैं डॉक्टर राधाकृष्णन जी और श्री नवीन कुमार को गुजरात में, पर्टिकुलर सूरत में इनवाइट करना चाहता हूं। आप सूरत में भी आइए, ऑफलाइन भी करते हैं, क्योंकि बच्चों को अभी ये टेलीमानस जो हेल्पलाइन है खूब बहुत ही जरूरी है। तो आप लोग गुजरात में भी, आपका स्वागत है। और आज का वेबिनार में बिहाफ ऑफ TNAI गुजरात बान की ओर से सबका स्वागत है। और स्पेशली डॉक्टर इंद्रावती राव मैडम को मैं बधाई देना चाहता हूं, क्योंकि उनकी पूरी टीम, डॉक्टर सोनल बेन पंड्या, डॉक्टर स्मितल बेन चौधरी, पूरी टीम कुछ न कुछ नया करते रहते हैं। इनकी वजह से स्टूडेंट्स को और समाज को बेनिफिट होता है। फिर से सबका स्वागत है। आभार। भारत माता की जय। वंदे मातरम।
Thank you, sir, for your kind word. As the sir said, society is very much prevalence in adolescence and young age. And for that also, some days we can say कि some month before we have seen our Supreme Court, UGC, our higher education also taken initiation related to National Task Force Survey. Indian Nursing Council also taken this survey. All the nursing institution will be joined with the survey. All the student, faculties, parents, they have to involve in this survey. And through that, they have to say that ki what type of the services, what type of the services we are providing through the institution, how we are doing the counseling, how we are guiding to our student if such type of the condition will be arised. So thank you so much, sir. Now we are proceeding. I must acknowledge the presence of Mr. Hitesh Bhatt, President, TNAI Gujarat branch, who always looking into the matter which maintaining the standard of our profession. I invite sir for presidential address. Hitesh Bhatt, sir. Sir, please unmute to Hitesh, sir.
Yes, madam. Okay. Respected esteemed guests, Madam Sampada, organizers and fellow participants, I am honored to address this webinar today. Our webinar theme is Telemanas and Overview. I am confident that the discussion and insights shared will contribute to nursing staff and healthcare personnel. I extend my gratitude to the organizer, Madam Moderator, speakers, and participants. Really, I had 30 years experience in this mental health. As I worked as a staff nurse, head nurse in this department. Typically, I worked at this first India's NABH hospital, mental health hospital for mental health, Vadodara. Thank you, and I wish the webinar great success. Remember 14416 for the Telemanas call. Thank you, madam.
Thank you so much, Mr. Hitesh Bhatt, sir, for giving insight about your services, how long you have been associated with the mental illness patient and how you have provided your services in these areas. So without further delay, let us begin our technical session. I invite Ms. Sampada Hanchinamani, nursing tutor, the National Apex Coordinating Center, Telemanas, NIMHANS, to present an overview of Telemanas, its vision, structure, and implementation. Welcome you, madam.
Thank you, ma'am. And first of all, I thank my team, my senior faculties, Dr. Radhakrishnan sir and Dr. Balmurugan sir, for giving me this wonderful opportunity to conduct a webinar for Gujarat state. And I really thank Indravati ma'am for arranging a more number of participants for this webinar so that they get the benefit of all this Telemanas services near to their door. And the Telemanas National Telemental Health Program of India. So Telemanas is one of the national program for a mental health, and Telemanas, full form already madam also told, and our dignitaries also told, that telemental health assistance and networking across a state. So this is the full form of Telemanas, and it is a digital arm of District Mental Health Program, DMHP. So today, under these broad headings, I'll be covering a Telemanas webinar. So the first one is a mental health burden. Second one is COVID-19 pandemic and the mental health. Third one is overview of Telemanas. Fourth one, Telemanas aims and objectives. And the last one, Telemanas functionality and its updates. So mental health services in our country, we all know like where it is exactly. हम सभी को पता है mental health के बारे में सोचने के लिए शुरू किए तो it's a less prioritized in our country and we can't reach each individual. So to improve these all concepts, so after the COVID also, we have seen like during the COVID, we have come across with a lot of cases that people were suffering with the mental health issues. And during COVID, we have seen 35% of people were suffering with anxiety, depression, and some other kind of symptoms and disorders related to mental health disorders. So in that, among COVID survivors, we have seen anxiety disorders, depressive disorders, substance use related disorders, and stress and adjustment disorders. So these are all the very common disorders or the symptoms we have seen in COVID survivors during a COVID-19. And then here it started the National Psychosocial Helpline during a COVID-19 to help COVID survivors. So this has become a main impact for to develop a telemental health program in our country. So National Psychosocial Helpline were there for telemental health care, and then National Psychosocial Support it was providing, and the service which was across our country, including the state and union territories. So with this psychosocial helpline, we have reached around 6 lakh individuals for providing a psychosocial support. So then the inception of Telemanas has been come, so telemental care services, so national telemental health program in our country. So this is all just because of a COVID-19 pandemic, which we have like suffered a lot. Before that also the people were suffering with the mental health issues, but we were not that much of concentrated on the topic. But however, the COVID-19 pandemic, we all have faced across our countries. And then the people started realizing the mental health is also a very important role, which everyone should take a very serious in their day-to-day lifestyle. Then a national telemental health program, a first time mental health has been concentrated and talked on the mental health topic, and the budget is given attention for mental health services in 2022 and 2023 by Nirmala Sitaraman ma'am. It is just to tackle increasing mental health issues and to support for reducing a mental health stigma and to provide a mental health services across our country. And that service, we call it as National Telemental Health Program, and that is launched on 10th of October 2022. All of we know that 10th of October every year we celebrate it for a mental health day. On the same day we have launched a 10th of October our telemental health first functionality and the inception. And National Telemental Health Program, Telemanas, is full form. Once again, I'll repeat, Telemental Health Assistance and Networking across our states. It's a Government of India initiative program. It's also a digital arm of district mental health program. It means that हर एक district में ये mental health services को हम लोग आगे लेके जा रहे हैं. That is the main aim. Then 8th of December 2022 में हमारा operational guidelines for Telemanas launch हो गया है. And aim of this Telemanas is to provide services of mental health across our country 24/7. The Telemanas toll-free helpline number is 14416. तो मैं एक और बार रिपीट करूंगी 14416. is a Telemanas toll-free number. So this is a service available for 24/7 across our country. The main aim is to provide affordable, accessible services. And objectives of this Telemanas: delivering accessible and timely mental health care and continuing services in the community, and facilitate timely referrals and enhancing a mental health care capacity and networking across our state. Principles of this Telemanas stands with the 3 broad headings. First one is accessibility, second one is affordability, third one is convenience. So accessibility, we have this service across our country 24/7, and it's available from anywhere at any time you can call. Affordability is it's a free of cost service, no need to pay any amount for the service. Convenience, we have a 20 plus languages services in this Telemanas program. So anybody with any languages people can call on this number for a mental health benefit or a services. And Telemanas is one of the important program which we have right now in our India, and this is how it bridges the gap. So previously during COVID-19, we have all seen that these people were suffering with the distress and the illnesses, and the people were having a stigma about not to go to the hospital with the mental health cases. The people may speak something different about one's own self, and then the people were giving a reason that it's very far, we can't able to go, or else they can't afford for the services. So these are all the difficulties they were facing. But right now, a Telemanas is providing a bridge for this all the reasons where distress to needed necessity referral services. The Telemanas is bridging the gap, and with this service, the people can move on with the nearest care services. Telemanas functionality, if we see, it's having 3 subcommittees. First one is a mental health service delivery by NIMHANS. Second one is a IT architecture by IIITB. And third one, health system domain NHSRC. So let's see how it functions. The NIMHANS is having a operational framework. Under the Apex Nodal Institution, NIMHANS, we have 5 regional coordinating centers, that is RCC we call, and 23 mentoring institutions we have. So one we have in Ahmedabad, same place we have our TMC cell also in Gujarat. And we have 53 Telemanas cells across our country. So NIMHANS will be providing design and innovative digitally driven models, content development for the delivery of this program, and collaborating and monitoring on day-to-day basis entire this program. And it is providing standard operational procedures, and it helps in providing ethical and legal issues. It provides some IEC materials for across a country, and it helps in for preparing a research-based evidence-based studies as well related to the Telemanas. And IT architecture will provide us for designing and developing IVRS platforms and technical support, monitoring developments related to ABDM. And NHSRC, it's providing a resource mapping for each state or UT where we have to locate the TMC cell, where we have to locate a MI or a regional coordinating center. Like that, resource mapping, everything will be providing by NHSRC. And it advises on policies related to health systems, organizations, or integration. And it helps in integrating Ayush health systems with the Telemanas mental health program. And you can see on the screen, so we have right now 53 cells across our India right now functioning. So anybody can approach a nearest centers where you are right now working or right now you are studying. So you have a nearest centers to coordinate for your mental health issues. And once you call on the Telemanas number, so this will be having a state cell workforce, and it works in the form of tier 1A, tier 1B, and tier 2. So I will explain this entire thing with a pictogram. So here, if you dial on 14416, your call will be connected to IVRS based system, and then next the caller will connect to a counselor. So counselor will lift your call, and they will provide us services when you are in distress, anxiety, or depression. And if you are facing any major mental health issues, the call will be connected to tier 1A, that is mental health specialist, where psychiatrists, psychiatric nurses, psychiatric social workers, and clinical psychologist will be connecting for the further more intervention. And this tier 1, we have even a video conferences which you can openly speak up to the psychiatrist or a mental health professionals, including psychiatric nurse, clinical psychologist, psychiatric social workers. And tier 2 will be in-person services. So if even a mental health professionals feels that the case or a caller needed even importance to the in-person checkup and all, they will refer a nearby telemanus cells, or else e-Sanjeevani or district mental health services, or else nearby PSC, CSC. If any doctors are available, they will refer to the nearest services which is affordable and convenient for the caller. And you can see on October 2022, we have launched our Telemanas, and April 2023, we have reached 1 lakh calls. And 5th of July 2025, we have reached 23 plus calls. And right now on 8th December, we can see we reached 30.26 lakhs calls right now. This is the today's data which we have added over here. And beneficiaries of Telemanas. So who can call to the Telemanas? So any individual with a mental health issues can call to Telemanas. Any individual who wants to help a person with mental health issues can call Telemanas. And Asha's behalf of screening in the community, if they face any difficulties, they can call even a CHOs, community health officers, while screening or identifying mental health cases. If they face difficulties, they can call, that is community volunteers. And teachers, behalf of students or teacher itself, if they are facing a mental health issues, can call. And behalf of any of your neighbors, you can call on this number and get the help of it to support your neighbors. And even a primary healthcare providers like MBBS, Ayush healthcare providers, nurses can call on this number behalf of a patient. So this is how the Telemanas is providing the services across our country. And till now we have received different kinds of calls, and most oftenly we have received calls related to sadness, stress, sleep disturbances, anxiety, exam, and substance related calls. We have received more frequently right now on a Telemanas. And these are our Telemanas manuals which are available on the website. And here is scanner. So if anybody want to know more about the Telemanas, please scan this and go to our social media website, and even us apps, Telemanas app also you can scan and get just join on the app itself. So thank you so much for giving me an opportunity for presenting a webinar on Telemanas overview. And thank you entire TNAI Gujarat for giving me an opportunity. And I thank once again Dr. Balmurugan sir for guiding me throughout this webinar. Thank you.
Thank you so much, Ms. Sampada, for giving a detailed insight and explore regarding the Telemanas. Just I'm saying to the delegates, just to remember the one toll-free number, that is 14416, which is 24/7 available. The care which is affordable, accessible, equally distributed. All the state is having this provision, these services. So those who are the beneficiary, those who are seeking the care, let take the advantages of it, and it is conveniently for everywhere. So Madam has given the detail regarding the structure, it's a vision, how the people taking the advantages of the Telemanas. Now it's our turn, how we will be making aware to the people, those who are needy, those who are seeking the care, and make them to reach till their doorstep. So thank you so much, Sampada ma'am. Now, for the deeper clarity, and this platform is open for the discussion. So I request you to all the delegates, if you have your questions, please put your questions on the chat box. And also, if you want to directly interact with us, we unmute you and you can interact and pose your questions. So for that, we have Dr. G. Balamurgan, Assistant Professor NIMHANS. I welcome you, sir. Sampada Madam is with us. So if you have any question, any queries, you want any clarity regarding the Telemanas, so please raise your hand, put your question on the chat box, and directly also you can ask. Gamit Nirmal is there. If you will unmute to Gamit Nirmal.
Yes, Ms. Gamit. Radhia Aruna. Ms. Radhia Aruna, you have any questions? Please ask. And as ma'am rightly mentioned, you can, yeah. So I think there is a question from Suhani Malhotra. Yeah, so considering how promising Telemanas is for lowering mental health burden in the future, I wanted to ask, as nursing students, how can we contribute or be trying to work with Telemanas? Is there any internship or volunteer opportunity for nursing students? Thank you, Ms. Suhani, for asking this very wonderful question. So one important point, as Ms. Sampath already mentioned, Telemanas is one of the major objectives is to reduce the gap, to reduce the existing gap between the mental illness, distress, and the healthcare facilities. So Telemanas is very, very promising program where you can call when you are in distress from anywhere in India. At any time you can call, and in any language you can speak. So that way, Telemanas is going to really help to reduce this mental health burden in India. And in terms of burden, if you see mental health continuum, so there will be a distress and well-being and illness. So if you are not handling the distress properly, the distress may lead to disorder. So the Telemanas is mainly meant to handle the distress. So if we handle the distress at the distress level, so we can prevent many of the people who are in distress and develop into a disorder level. So that's why it's going to help the mental health burden, reduce the burden. And second thing is how nursing students can be a part of it. So one important point I request from all of you is, as nursing students, I request all of you to make use of this number. Whenever you are in need, you can call this number at any time. Second, when you are going to community or home visits, please share this number with the school children and the home visits to the family, and share this number to your friends and the family members, so that whoever in need, they can get help whenever they are in need of such help. And internship part, what we can do, we can have some kind of observation visits to the Gujarat state cells. You can talk to the Gujarat state cell, they can go and have a visit. But in internship point, I think we have to talk to the state Telemanas team. Otherwise, it is a national program where the Telemanas counselors are recruited by state government, and NIMHANS, we train the counselors recruited by the state governments. So there will be notification released by the state government, then people can join as a Telemanas counselors or mental professionals. So thank you for asking this wonderful question. And next we have, so what type of, I think Nazir Halim asked, what type of documentation and follow-up systems to use to track repeat callers and for those who need continuity of care? Thank you, Nazir Halim, for asking this very important question. So we do have follow-up, but point here is the follow-up is completely based on the consent of the caller. So a caller calls and we trained our counselors to address the distress of the caller. And we have a provision to deliver some kind of basic interventions we call Manasvita. So for that Manasvita, our counselors will educate the callers how to handle distress by following this intervention. And our counselor request and ask the caller, is it possible to call you back? The callers give consent, then our counselor will schedule a follow-up calls based on the time and availability of the callers. So that's the way we are doing follow-up with the callers. An important point here I would like to highlight here is a few states have a structured follow-up. For example, if a caller calls with the thoughts of self-harm or suicide, And the structure SOP says that caller needs to be followed up at least twice in a week for first week. The next week, at least once in a week. And there will be 2 weeks once. So something like that, there will be continuity of calls will be made by the counselors to the callers. Again, it based on the consent given by the caller. So this is why we are doing all the follow-up calls. And documentation, if you see, again, I would like to highlight here, Telemanas is 100% confidential. What does 100% mean here? None of the calls are recorded. I repeat here, none of the calls are recorded here. And Telemana system doesn't require your name, your age, from where are you calling. If the caller is willing to share the information, we will add in our IVRS system. Otherwise, we do not ask any of your information. The number what you're calling, the 10-digit number, will not be displayed to the counselors. So counselors will not know your number. Your number is protected. And the counselors will not know to whom they're talking. And you will not know the counselors. So that's the way the confidentiality is maintained. Only minimum conversation what happened between the counselors and the callers will be documented in a write-up. So none of the calls are recorded, videos are recorded. So that's the way we are managing the documentation here. I hope, Nasir, I answered your question. And Hani Patel asked, what if a patient needs medication? Does Telemans provide a prescription? I think this is a very interesting question here. So in Telemanas, what we believe is if the caller calls, our counselors, the Telemanas counselor can address 80% of the callers. However, remaining 10 to 15, they need support from a mental professionals, including a psychiatrist. As Ms. Sampatha explained, if the caller needs a consultation, our psychiatrist will transfer the audio call into a video call. That's called as video consultation. So during video consultation, we have a provision in Telemanas itself. E-prescription will be generated. So the caller can call from, please remember here, in Gujarat, any nook and corner of the part of Gujarat, dial 14416, talk to a counselors, get consultation from a psychiatrist, and get the e-prescription at free of cost from your place, from where you stay. So that's the way Telemanas is functioning here. And we adhere to the National DPDP Act and the National Telemedicine Guidelines, as well as the Mental Health Care Act 2017. Yeah.
So the next question is, are the calls recorded? If yes, who can access the recorded information? So our mental health professionals can use this information, but sir,
First, as I told you, none of the calls are recorded. Please remember, in Telemanas, no calls are recorded. Only the session taken between the caller and counselors are written in a platform for the further follow. And Maitri Patel asked, are these opportunities for BSc nursing students or nursing personnel to be involved in Telemanas as educators, counselors, or researchers? Definitely. So one of the qualifications for Telemanas counselors is BSc nursing with 2 years of experience. So that is a qualification. Second, we have the mental health professionals. One of the mental professionals is psychiatric nurse. Those who completed MSc in psychiatric nursing will be appointed as a mental health professional, as a psychiatric nurse in the Telemanas system. I think Ms. Sarika asked, does the Telemanas only address acute cases or chronic also? Does it provide therapies? Thank you, Sarika, for asking this interesting question here. As I told you earlier, the 80% of the callers needs distress reduction counseling. The counselors are trained for that purpose. However, the remaining 10 to 15% need any therapies. As per the protocol, the therapies will be provided by the mental health professionals, which includes a psychiatrist, psychiatric nurse, a clinical psychologist, and a psychiatric social worker. So the psychiatrists have the option to provide e-prescription, and other 3 professionals, they can do a non-pharmacological therapies. So that is possible over telephone and video consultation. Next, Sarika asked, does Telemanas only address acute cases, as I told you, and we handle all type of calls. It need not be in any acute or chronic. Depends upon the calls, we deliver the service for a basic brief intervention or therapy or a consultation, or we refer them to nearby facilities. What if a patient needs medication? I think as we discussed earlier, we have answered. And Rachel asked how telemanas can be useful for community people and public health setting, and how can, as mental health staff, we can involve and contribute in it. Thank you, Rachel Christine, for this question. As I told you earlier, as health professionals, first request is use this number whenever you are in distress. And second, share this number wherever you have meet anybody, you can share this number. Third, in public health services, as I told you, as Ms. Sampada explained, a medical officer in the PHC, if he is consulting a patient, suppose he suspect the person may have some medical mental illness, he can dial 14416 and he can have a consultation with the tele psychiatrist available in the cell. So this way we can do a collaborative video consultation. So this is for the medical officer. Similarly, a nurse working in the CHO, in the Health and Wellness Center, Ayushman Arogya Mandir, they can, when they are interacting with the patients, if they suspect the person may have mental illness, they can dial this 14416 and have a collaborative video consultation with the team in the telemanas cells. And Ms. Afrin Jamadar asking, does telemanas only address acute? I think this we have addressed. And Harsh Hamid asking, can you suggest me about mental suggestions for insomnia? Okay, so first suggestion is call telemanas. Okay, so call telemanas number. Our counselors will help you to have some kind of thoughts or inputs, so how you can improve your sleep pattern. At the same time, if it is not improved, the telemanas guidelines suggest talk to some mental health experts. Those are available in telemanas also. And Krisha asked, does telemanas record our conversation? As I told you, no. How can telemanas prevent academic dropouts related to mental health issues? So academic dropouts, as I told you earlier, if the distress is addressed in the right time with the right kind of therapies and the interventions, definitely these dropouts can be managed. That's the way those who are having concerns will advise them to, or we are asking all of you to share the telemanas number so that they can get help from this telemanas service. Then again, patient medication we discussed. How many centers in Gujarat? As sir already mentioned, we have 2 centers in Gujarat. And Akshat was asking, India has diverse language and cultures. How does telemanas handle communication barriers when callers speak different dialectics? As I told you earlier, telemanas provide service in 20 plus languages. For example, in Gujarat, suppose you are from Maharashtra, you are studying in Gujarat. If you dial 14416 within Gujarat, the call will be connected to Ahmedabad. The counselors will address in the local language. And if you request the counselor, I want to talk to somebody who knows Marathi in Maharashtra, we have provision to transfer a call to Maharashtra. So we have 80 counselors in Maharashtra, they can support you in Marathi language. So that's the way the language barrier is managed in telemanas. And Purvi Patel was asking how nursing students and staff nurses effectively integrate telemanas. As I told you, students, you can share this number to you and your friends, family members. And staff nurses, I request all of you to share this number with the patients and family members. When they are in distress, especially those who are working in the chronic disease conditions, chronic kidney disease or cancer, and patients, family members may need some kind of support to reduce their distress. So share this number with them. And Gautam was asking, how can I manage stress during exam with posting? Again, the suggestion is call telemanas. And Nazir, what outcome indicators are being used to evaluate the effectiveness of telemanas? As I told you earlier, the number of calls, as Sampata was mentioned, the calls rates are increasing very linearly. So we reached around 30 lakh plus calls as on today. Second, we have the quality indicator of feedback from the telecallers, that is end users. So the system will generate an auto call after end of the call. There will be a feedback call sent to the callers. The callers can rate the counseling provided by the counselor at the rate of 1 to 5, and that feedback we are getting. And as far as our learning, most of the feedback was above 4 out of 5. So therapy, medications we discussed. And what are the communication skills essential for nurses while handling telemanaged calls, especially crisis calls? As nurses, as I told you earlier, please share this number. And when you study mental health nursing, there we use therapeutic communication techniques. Those are the skills. Active listening, paraphrasing, reflecting, everything you study during your mental health nursing in 6th semester or 3rd year. These are the skills required here. And I think somebody was raising hand. Ma'am, it is 12:09. Shall we go for some more questions, ma'am?
Yes, sir, no issue. If the
Yes,
questions are there, if they have queries, we can.
Yes, ma'am. So Om Patel asked how you implement telemedicine in India, where most rural have no awareness about mental health. So very rightly pointed out question, Mr. Om Patel. So this is the reason we are discussing with all of you. So now we have around 1,000 members on the Zoom and 300 members were watching in YouTube. So now these 1,300 people are our Telemanas ambassadors. Now you are the Telemanas ambassadors. Please share this number with people you know. Maybe you may be from rural or urban or any part of your Gujarat or India. Please share this number with others. People you know. Suppose you share this number with the 10 people, some multiplier effect will be there. So 1,000 will become 1 lakh or 10,000 or 10 lakh, it will go something like that. So that's the reason we are sharing this webinar to all of you. Please share this number and take it up forward. And Purvi was asking what types of mental health concerns are most commonly reported. As Ms. Sampada presented, sadness of mood, stress, these are the sleeping issues, these are the common concerns. And Anjali Sharma was asking, through this app or from Telemanas, can we get all information or solution in our daily living mental stress and anxiety? So we have Telemanas app is available both in Android as well as in iOS platform. So right now the app has the basic information and you can get help through the app for your self-care improvement and distress reduction. And also we have a chatbot with the menu-driven chatbot. You can ask the specific question to the chatbot, it will respond to you. But it is restricted to the very, very basic level because we encourage people to talk to a human being, that is our counselors. So Mukta Singh was asking, please share the number. Anyone can type the number in chat box? What is the Telemanas number? You don't type. Any participants can you type? Because somebody was asking Telemanas number. Yeah, Hitashi typed 14416. Thank you for typing there. Many people, Dr. Prem Kumar is typing. Very good. Thank you very much. And there is a question on how emergencies are handled. A very interesting question actually. So if you see the Telemanas app, there we have listed our success stories. So the very crucial success stories, what we say here is handling calls where the caller is having self-harm thoughts. So here what happens, self-harm is an emergency. So as soon as our counselor receives the call, as per the standard operating procedure, the calls will be escalated to the mental professionals. So mental professionals are trying to handle this kind of thoughts. So what we try to do is we try to verbal de-escalate this distress. Meanwhile, we try to connect somebody near to the caller. For example, in Bangalore, we have got support from the police 112, that is patrol service. So we called to that police and police reached the nearby place. In Maharashtra, we could able to connect to the person to a nearby healthcare facility. The person went to nearby health facility. In another place, the person shared the friend's number. So in another line, we contacted the friend. So the friend reached the person. So the ultimate objective is try to connect somebody near to the person so that they will get the in-person support. So that's why we're trying to support the person with mental illness. Yeah, I'm very happy. Many people are typing this number. Yeah, so Suguna was asking follow-up can be done, any registration is done for the patients. And here we don't call them as patients, they are the callers. So as soon as you make a call to Telemanas, one Telemanas ID will be created based on the number from where you call. So that will be our record. And if you call multiple times, through the number, the multiple records will be coming up, the description what you have written. So that way we'll maintain the details. So I think we have answered most of the questions. I think mostly all the questions you answered. Still, anybody like to ask any question, you can raise your hand. Yeah, another question is, does Telemana share information with any handles or government, or it is totally confidential? Ma'am, it is totally confidential. The data, what is available here is completely kept here, and no one have access to this data unless otherwise the Apex Coordinating Center and Ministry of Health and Family Welfare. Yeah. So again, Nazir was asking if the person is residing in a remote area and don't have access to any physical facility. After the call, if needed, do the Telemanas team visits the person. So our aim is Teleman is not the independent program. We want to connect the existing service. That's why we call networking across states. So already in India, we have more than 700 districts. We have district mental health program. So as like any persons in the remote area, definitely we try to connect that particular person with the DMHP team, that is District Mental Program team. So that team will go and address the patients in that area where they are unable to get treatment.
I think so. All of the questions completed.
Yeah.
Balamurgan sir, just simply I'm asking, if someone is called and they are conversating, how long we will be attending their call? Is there any duration we will be attending for the 3 minutes, 4 minutes, something?
Ma'am, there is no limit for this. There is no time limit here. But our experience is all the routine calls and an average 10 to 15 minutes we could able to come for some kind of consensus. So that's our experience. But we have a experience where we could, that example as I told you, the person with the distress and self-formed thoughts. We spent more than an hour, more than 1 hour, 1.5 hours.
Yeah.
So that's the way we are. There is no time limit here.
Okay, some type of the candidate who is saying that I'm having anxiety, and due to this anxiety, they are making all the factors, external factors. So they are saying that these all the factors are associated, and due to that, I'm having the anxiety or stress. How we identify what the person is saying, it is correct, or maybe they are manipulating, they wanted to pose on the someone. So these things, how we can, because here just we are listening the voice, we are not able to see their expression. So how we come to know in person if the persons are there, by seeing their expression, their non-verbal communication or all, we can identify many of the things what the person wanted to say. But telephonic, based on the voice only, we are perceiving. So what to do in such type of the cases?
Ma'am, very, very wonderful question, ma'am, actually. These are the limitations of telemanas, actually. But still, how we handle, I tell you, ma'am. So if the person is calling the complaints of distress, our counselors first will address. And with the interventions, they'll do follow for 2 to 3 weeks, not more than that. With this, if it is not reducing within 2 to 3 weeks, the caller will be addressed, will be handled by the mental health professionals. So they are the professionals, a psychiatrist, a psychiatric nurse, a clinical psychologist, psychiatrist, social worker, and they handle this caller. And if the mental professionals feel this person, I think there we have options of converting this audio to video call. So we can do a video consultation. But still, if the mental professionals feel that person need inpatient, in-person care, we encourage the person to meet a healthcare establishment near to their facility. So this is the protocol we are following it.
Okay, thank you, sir. Sir, another question I have,
Please,
as we are saying that this is the digital era.
Yeah.
And now this G generation, they are feeling that Chat GPT is their friend somewhere. Okay, whatever they have the problem, whatever the thoughts is coming in their mind, they are thinking Chat GPT is the tool which is giving the solution of each and everything. Their assignment, their doubts, even though in the class also we will see that they are not much concentrated. They feel that after that we will go and ask to the chat GPT will give all the answer. Somewhere due to these tendency what they have, they are gradually indulging on it. And due to that, because the chat GPT is having endless answer, whatever you ask, chat GPT is having the answer and definitely give the answer and trapping you in one in another answers. And due to that, the person is also leading stress. So what would you like to suggest? Whatever this generation will do, how much, see, whatever the things, whatever the tools, AI, if you will say, it is a boon for us because it's a helpful in the many of the areas. But the in contrast way, we will see there are the many of the disadvantages also. So what suggestion you want to give our this young generation, because many of the students have joined here, so what they can do and how juridically, I can say that word, they can use this AI?
Yeah. So thank you, ma'am, for a very pressing concern you asked right now. And again, I tell you, if you call Telemanas, you'll get detailed support. But I would like to highlight on 3 important tips what we can follow it. So first one, I suggest access. So access in the sense, you decide when to use your device. Okay. For example, we have something called no phone zone. So you practice yourself no phone zone, everybody. So for example, in home, we have place for everything in our room, in our home. So there will be some place we keep all the kitchen utensils in kitchen, and all these sleeping materials will be there in the bedroom, and living room we have few things. We will not mismatch all these materials. Similarly, you decide a place where you can watch or use your device, a mobile. In terms, I'm telling in terms of device, it may be a phone or laptop or tablet, whatever the things. So each one of us should take a call. I try to use my device only in this particular place of my home and living room. I will not take my phone to my bedroom. I will not take my phone to my kitchen. I will not take my phone to my bathroom or washroom. So that we should take a call because this is only an individual discipline. Second thing is no phone time. So first is no phone zone and no phone time. So you decide I watch phone or device for 1 hour, 2 hours, whatever may be the time in this period only, or 7 to 8 or 8 to 10 or 10 to 12. You try to fix that and make yourself not to use in other times. And third one is try to have more offline friends. So go and meet the people. So try to meet the people in person. And if you talk to our Telemanas counselor, they'll discuss a lot. But because of time constraints, I would like to highlight mainly these 3 things. So try to have a no phone zone in your home or hostel, wherever you are. And then no phone time. So where you can fix up some time where you can use your phone half an hour, 1 hour, whatever may be the time. Third, try to meet in person your friend, your parents, your teachers, or whoever may be the people.
Thank you so much, sir, for giving great clarity regarding the Telemanas.
Yes.
As we move towards the close of the today's session, let us carry one powerful reminder with us. No one should struggle in silence. No one should feel alone. Help is just a heartbeat away. Telemanas is not just a number. It is a voice that listens, a support that comfort, and a pathway to healing. Let us become ambassador of mental health well-being. Let us talk, share, listen, and encourage others to seek help without hesitation. Remember, 14416 is not just a number. It's a hope, it's a care, it's a courage. Together, let us build a community where reaching out is celebrated, where seeking help is seen as a strength, and where mental health support is accessible to every person every day. So now, on behalf of TNI Gujarat branch, I extend my heartfelt gratitude to Dr. Pragna Dabi Madam, Mr. Deep Kamal Vyas sir, Dr. Radha Krishnan ji, Mr. Hitesh Bhatt, Mr. I.A. Kadiwala, Ms. Sampada, Dr. G. Balamurgan, all our expert speaker, all participants for your active engagement. and everyone behind the screen for their dedication in making these webinar a success. Thank you all for the joining us today. Stay aware, stay connected, and let us continue spreading the message of accessible, compassionate mental health care for all. Thank you, everyone. Thanks a lot. Thank you, sir. Thank you,
Yeah.
madam. Thank you.
Thank you very much, ma'am, for organizing such a wonderful and very good number of participants. Hope this message reached all of you and they can take it forward. There's a humble request from our side, ma'am. And thank you, Indravati ma'am and Deep Kamal sir and Registrar ma'am, all of you for your valuable time and all the participants for spending with us the last 1.5 hours. And our team here, Mr. Balakrishna is helping us in all the Zoom meeting, and then Mr. Nishant for this YouTube live streaming, and Harsha was designing the wonderful brochure, and Sampata, of course, so was handling the entire program. So thank you all. Thank you very much for your patience, listening, and time. Thank you very much. Thank you.
Once again, thank you to all. Thank you.
Hello. Hello.